This next chapter, we're going to talk about your clinical education, going from the classroom to the clinic. And you have some objectives that you will need to be able to describe and answer here. So explain the purpose of your clinical education, define the terms that relate to your clinical education, describe the physical and human resources necessary for your clinical education, explain the importance of adhering to major clinical education policies, which is really important, discuss the methods used in effectively teaching a clinical course, describe the methods of assessment, and summarize the clinical education process. So you go from the classroom into lab. Then we transition you into the clinical setting. So when we are working with you and trying to get you through the 2-year process and learning all the different positions for every single bone in the body, it requires a whole team. So just keep that in mind as we go through this whole process here. So your education in the radiologic science is emphasis in learning will shift from classroom setting to your clinical. So we start off with you going to class 2 to 3 days a week and going to clinic 2 days a week. Then we shift you second year going to clinic 3 days a week and class 2 days a week. So it does shift to get more clinic time in towards your second phase. So the clinical setting allows the student to integrate the knowledge gained from the classroom into clinical practice, actually working with live patients, well, hopefully live. The purpose is to provide an environment in which the student can transfer learning from didactic to laboratory, and then we take it to real patients. But we want you to practice first. We want to teach it to you, then we want you to practice it in our lab where it's controlled. And then we want you to go into the hospital setting or clinical setting and practice on patients with direct supervision, and then you can slowly wean off the direct and get competent and move to indirect supervision. So it's a transition. It's not something that we just throw you in there to do. So all your positioning requires prior learning in the classroom and the laboratory, and it gives you one-on-one training before you get to that direct patient contact. So as you see here, we're really heavy on your classroom education, and then we transition you into a heavier weighted clinical education. So the taxonomy of learning. So education is a medical imaging professional. Professional will include 3 areas of learning. So there's cognitive, affective, and psychomotor domain. So the cognitive deals with knowledge, understanding, reasoning, and judgment, whereas affective deals with attitudes, values, feelings, emotions, all the touchy-feely stuff. And then your psychomotor deals with the physical actions, your coordination, physical skills, neuromuscular manipulations, so your actual tangible skills. So we actually go in and take a look at you and make sure that you are able to treat the patient in an effective manner by looking at your cognitive, your affective, and your psychomotor. And all of our assessments do have these components to them, although we don't call it out as cognitive, we don't call it out as affective, and we don't call it out as your psychomotor. So if you look at all your evaluation forms, we have all of this integrated in. So your learning process, it's based on performance objectives, which is a description of observable student behavior. And we look at your competencies, so the observable successful achievement of the performance objectives. And then your outcomes, so learner focuses on it, identifies and what the student should be able to achieve. Okay, competencies. ART has established a minimum number of competencies that you have to do. There are mandatory competencies, there's general patient care competencies, there's elective competencies, and then there's just continuing into technical competencies, which are considered optional. In our program, your advisory team has taken a lot of these elective and continuing technical competencies and moved them into mandatories. So your comp sheet is going to look different than another school's comp sheet, just so you know that we've changed things a little bit according to our program. So competencies are in 3 classifications again. So you have the cognitive, psychomotor, and affective. So same thing. And your clinical competencies, when you are getting your competency, let's say on a chest x-ray, you have to do it independently. And we watch for consistency and to make sure that you're effective in doing it independently. So if we notice that on a portable chest, you got a portable chest comp, we signed you off, all is good, and then we come back in a year and your angles are all wrong, you're clipping consistently, we can pull that comp and say you need to do this again, and show us that you can consistently do a portable chest x-ray. So the school does have the a way to do that. So we do take a look at your prior comps and make sure you're still consistently producing a good image. So your supervision can be direct or indirect. Direct supervision is the tech reviews the request. They take a look and make sure that you're able to do the exam, and they are physically present during the whole procedure. Where indirect, the tech reviews and evaluates and makes sure that you're able to do the exam, and the tech is immediately available if you need help. So that's once you've proven that you're competent in performing that type of exam. All repeats and fluoro studies, including C-arm, GI studies, anything with fluoroscopy has to have direct supervision at all times. So organization chart, so ours looks similar to this. So we have the program director here at the top, and then we don't have didactic faculty. We are a little small for that, so we have the program director, then we have the clinical coordinator, and with Mesa College, the program director and clinical coordinator are lateral, where it's not a step up, step down. Even though the program director does oversee the whole program, and the clinical coordinator oversees the clinical component of the program, at Mesa we are lateral to each other. So a normal organizational chart is program director, and then the program director oversees the clinical coordinator, and then we have, they say clinical faculty here, so the clinical faculty is at the facility, and this person typically is a clinical instructor. So this is your CI. And then under your CI or lateral, so it could go either way, so it could be here or here, either way, is your technologist that you're working with, so your clinical staff. And then you're underneath all of that. So it could have here your CI and your technologist, and then you're here, or it could drop down to where the staff is here and then you're down at the bottom. You'll work your way up, don't worry. All right, so we talked about this. You have observation, so with your phases of learning, so what you're going to do is you're going to go in, you're going to watch. You're going to watch exactly what the tech is doing, why they're doing what they're doing, and making notes. Then you're going to step in and you're going to start assisting and aiding the tech and giving more hands-on, and you're slowly going to integrate into where you're able to perform the exam without the assistance of the tech. So it's not just you do one, see one, do one, teach one. We don't have that philosophy. I want you to see a bunch of them, and I want you to slowly integrate yourself in, and I want you to be more hands-on, and to where the tech feels comfortable, you feel comfortable in performing the exam independently. All right, some major clinical education policies. So supervision. When you're in the clinical setting, your supervision is one-to-one. You have to have one tech to one student under certain circumstances, and it has to be rare. You can have 2 students to 1 tech, and that's just if you're shooting something very obscure that you don't see very often, but it has to be 1 tech to 1 student at all times. So performance of actual examinations. Here you need to actually perform these exams as you progress. So you go from observing to assisting to independent. So you need to do it on live patients in the facility. It's not just a matter of you just practicing on each other. You can do some simulations. We allow 3 simulations at Mesa, so you can do 3 exams on your master comp log. that you did not do a live patient, but it needs to be signed off by your clinical instructor, and the program director needs to be comfortable with that. All right, so assessments. As you know, we have to have assessments on you. So JRC-ERT requires us to provide data. The college requires us to provide 3 pieces of information as a minimum for each course to ensure that we are providing a learning environment for you that is successful. So there's lots of assessments where everyone's taking a look at you and making sure that you're progressing along appropriately. So radiation protection practices, we have to supply you with a radiation badge. We need to make sure that you are shielding also all your patients. So it's not just a matter of us protecting you, it's you protecting the public also. Disciplinary procedures, so if you do something that is not legal or ethical, which actually we have our professional ethics in the book towards the back. Your professional ethics is, let me see, on page 362, and it talks about 10 different items on there. So you'll want to read your code of ethics because you have to follow them, and your practice standards are on page 350. Starting on page 350, and those will give you an idea of the ethical standards that you must uphold, and there'll be disciplinary actions based off of different things that you do that are not standards and break ethical codes. So our job as the program is to make sure that you are clocking in appropriately, that you are taking your meals when you're supposed to, that you are not violating any laws or regulations. So that's what the disciplinary procedures are for, to make sure that you're safe and the facility is safe and the campus is safe. So there's your professional ethics. It's in the back of your book. Your practice standards, you have HIPAA, which is under your practice standards, so you have to abide by HIPAA. Any violations in HIPAA would be grounds for termination in the program. Very, very serious and not okay if you violate it. So we do need to know if there was a breach, and we have to report it. So unfortunately, it's not something we can sweep under the rug or look the other way. So you have to look professional, and you have to behave professionally. So our job at the college is to get you from someone who's never stepped foot in a hospital all the way up into a full functioning tech, where you're able to communicate with physicians, with the CEO of the hospital, with supervisors, with nurses, everyone in a professional manner. That's why we say your scrubs have to have the patch on them. The public has a right to know that you're a student. Your hair must be pulled back if it's long or touching the shoulders. Your scrubs are to be clean, and they're not to be wrinkled, pulled off the floor. You have to look professional, and you have to behave as a professional. You have to be in clinic. It's not an option for you to be late every day, every Monday, leave early every Friday. We consider this like your job, so it's important that you get there on time. And when I say on time, I'm talking 15 minutes early. So you get there, you put your lunch away, you put your coffee away, whatever you have to do, so that when you start at 7 a.m., you start with patients at 7 a.m., not walk in the door at 7, put your lunch away, chat with everybody, and then start at 7:15. No. 7 a.m. is your start time. 7 a.m. you have a patient. So, or at least ready to have a patient. And walking in late is just not going to work. You have to notify the campus that you're going to be out for the day, and your clinical instructor. And we require you to do it prior to your start time. So if you do it after your start time, that is a disciplinary action. So if you're pregnant, you have the right to declare your pregnancy. You also have the right to undeclare your pregnancy. So we need that in writing with your due date. So if you're going to declare pregnancy, we need to know in writing and your due date for your baby. All right. So student clinical development, it's competency based. We observe, assist, and perform. So we watch you go through all those phases, and we make sure that you're on track for your clinical level. All right. allows for transition in theory into practice in the real-world setting, and designed in accordance with the standards of accredited educational programs in radiography, which is J-CERT. So, in conclusion, clinical education is essential to the development of a competent medical imaging professional, and use performance objectives as learning tools to enhance the learning experience. Clinical education will increase as you develop knowledge base through classroom laboratory activities, and the student has personal responsibility to maximize clinical experience to become the best imaging professional possible. All right, there it is.